superior, Mr. Independent, doesn't need anybody. The superior is his feeling that he doesn't need people, he can get along without them. You don't need anybody. Human emotions are beneath him. He can do without it.
That's not the superiority.
He doesn't want to experience feelings of being vulnerable and dependent on people, because if he did, he might be hurt. So as a result, he keeps himself very much aloof and emotionally cut off from people. Now breathe.
Because they are dealing with powerful psychological as well as physical forces, only individuals trained first as physicians, then as psychiatrists, and finally as medical orgone therapists can safely and responsibly conduct the work that is Wilhelm Reich's legacy.
Your evaluation of the patient medically is critical in how you proceed. When there is no armor and you press on the muscle, the person experiences no pain. When there is armor and you press on the muscle, the person experiences pain, discomfort, or anger.
Do it again.
Patients do a lot of coughing when they are unable to express an underlying emotion such as crying or rage. They often go into spasms of coughing.
When Konya pushes on my chest, I get a great deal of relief. I mean, it hurts, but then at the end, it's very relieving. And it's so dramatic that it also helps trigger feelings. I've always felt I was capable of doing more. Well, if you're so damn capable, why aren't you? You know, the reality is there's something keeping you from it. And that's what I want to get to. I want to get to the bottom of me. Because I do want to be someone who contributes, someone who has a fulfilled life, and boy, if we could use that word happy, wouldn't that be nice? I'd like to be happy. And I'm not far from there, but I'm not happy. I'm happier.
Winnie has been in medical orgone therapy to help battle her deep-seated fears that she will be abandoned, left alone.
When she first came to see me, she was timid, very shaky, insecure, didn't know what she really wanted to do with her life. And now you see a much more poised, charming individual who is quite easy in speaking about herself and what she wants.
Well, I hate feeling tired and negative thoughts.
What kind of negative thoughts are you having?
If I start to feel good, really good,
Yeah.
something stops it.
That's
It's like I start thinking of negative things just to make sure that I'm not too happy.
But that is it. Yes.
When I first came here, I was really scared that my husband was going to leave, and I couldn't handle that at all.
Other feelings.
It had almost no basis in fact. He would say it had none.
I just won't like what's there.
Jealousy played a big part in it.
Mhm.
I won't survive.
Mhm.
I just always felt like you have to be prepared for the worst. So therefore, don't ever enjoy yourself, because you never know what may be around the corner.
Kick, Winnie.
You have to be able to, first of all, trust your therapist, and second of all, trust the idea that your brain cannot control everything in your life. Your whole body is working together with your brain.
Well, there are three fundamental techniques in medical orgone therapy. One is character analysis, which is verbal interchange, where you bring a patient's attention to their attitude, to their demeanor, to the way they're resisting the process. The other method is by breathing deeply, naturally, builds up excitation, and will heighten both their emotional experience as well as their defenses. The third way is by directly addressing muscular rigidities to release the emotion and the energy that's held in that segment of the body. Breathe into it. I pushed gently down on her jaw, which increases the excitation in that segment of her body. She's fundamentally timid and has difficulty speaking up. But as that excitation increased, then she more readily got into the deeper emotions.
The feelings that I had were that just this feeling that's been pretty overwhelming, that I was someone that different from what my parents expected. It's kind of hard to talk about it. But, yeah, that's pretty deep. And I never realized it.
In the session, she began to scream at her parents as if she were a little girl, re-experiencing the inhibited emotions that she couldn't express, that she ran away from. She chronically felt both mother and father pushing her and not allowing her to simply be and be herself as a child.
It doesn't fascinate me anymore to know that because my mother did this or my father did that, that's why I am the way I am. I mean, that's a given. For a while, I was angry with them. I don't blame them anymore. They did all they could.
It's a good place to stop.
The anger and jealousy that I felt when I first started are still there, but I really don't act on them in any way.
I feel like a different person. I'm ready for the future. I'm not trying to control everything, and everything doesn't have to be perfect. And I think I'm a much nicer person to be around. I'm happier to be around me.
One of the goals of medical orgone therapy is to enable patients to become better parents. Much of Reich's work focused on the importance of preventing early childhood trauma. His concerns have gained increased acceptance, leading to a growing emphasis on natural birthing. Michel Audant, world-renowned obstetrician, author, and lecturer, is an outspoken advocate of natural childbirth.
One of the best possible situations for a woman to have an easy birth is when the laboring woman is in a small room, a familiar place, with nobody else around than an experienced, motherly, and low-profile midwife. In such conditions, some women who probably cannot give birth in a conventional hospital are able to give birth easily by themselves without any drug.
Slide down with your head there.
Yeah.
That's it. Let's lie straight. There you go. Put your arms down.
James, who is 5, suffers from attention deficit disorder, a condition that may be related to his traumatic birth. His life both at home and in school is severely disrupted by his inability to focus and appropriately express his emotions. His parents want desperately to avoid the typical drug treatment for ADD.
You can lie still. Keep your feet still.
My boss's son has been on Ritalin for a number of years, and that's one of the things we didn't want for our child. We didn't want him on drugs. Growing up having to take something all his life.
Treating children's a very different experience than treating adults.
I got it.
There's no way you can sit back and take your time and observe and see what's happening. Something's happening every second, especially a child like James. You've got to be not only totally focused, but really right there with the kid. The thing that James is avoiding over and over is to feel any of the vulnerable feelings. Fear, anxiety, sadness, and even love that make him feel vulnerable. And he avoids that by being aggressive, by being active. The aggressive feelings have to be discharged first. So I would engage him in anything of an aggressive nature when I felt like that was the feeling that was coming to the surface that needed to be discharged before we could get to the other feelings. We do lots of things that many people would see as, well, they're just playing, you know, what's the big deal? Is this therapy? And the difference between just playing is that I always have some sense of where he is and what's going on, and that the function of all of this is to help him make better contact with himself and to be able to help him feel what's going on emotionally.
James' problem started probably at birth. They were determined to get him out vaginally, and then they put forceps on him. But by the time they got his head down, they realized they couldn't get him out, and one doctor pushed him up and the other doctor took him out by C-section. And looking at the pictures, he was not a happy baby when he was first born. I was depressed about all that, so that certainly affected him when your mother is crying all the time. I wish I had known then, because he could have had therapy then. Things could have been better from the get-go. It's sad for me to think about it now.
Now just look at me. Look at me. I think you're very nervous. You might wonder where all this sadness comes from in a child who's only 5 years old, and it goes to the depths of the problems we're dealing with in orgone therapy. An infant, from the moment it's born, needs to have real, genuine emotional contact with their parent. And if it doesn't have it fully, it starts to feel frustrated, it starts to feel a tremendous loss and deep feelings of sadness and anxiety. And that's what he's dealing with. It doesn't come from what we know cognitively. That's what we know in orgone therapy that is different, is that these are biological processes. Let's let it out of your back. That's what it is. Say no.
That just lets me say ouch.
Okay, say ouch.
No.
Yes.
Ouch.
I put my hands under his back and was pushing on the tight muscles in his back. It was at the point where he was starting to act stubborn, starting to say no, and these are the muscles that people use literally to hold themselves back like that. My sense was that there is sadness and tears in him that need to come out, and I was trying to do something that would facilitate them coming out. I wasn't doing it to hurt him or to make him cry. I just try to help overcome the thing that's holding it back. That's it. It's okay. Let it out.
Stop! Oh, stop!
James is a great kid in a lot of ways, and more that comes out, the more he's able to tolerate closeness. Therapy has helped him be able to verbalize his feelings and not run away from them.
I've been very happy to hear from his mother lately that he has come to her and asked for a hug. He has come to her and asked to be held because he was sad and cried. When I first started seeing him, he could not do that. He would fight her off if he hurt himself and started to cry, and she would try to hug him. He wouldn't even let her.
Here we go. In an increasingly complex world where many have been disappointed by quick fixes and miracle drugs, a new generation of therapists and parents are re-examining the work that Wilhelm Reich pioneered over a half a century ago.
Again? It seems that people are more and more curious about Wilhelm Reich, as if they feel that he has been really a pioneer, as if will be an interest to read again his books in the current scientific context. And when they ask me what is the most important aspect of his work, often I say, perhaps the most important book which has been published during the 20th century is The Murder of Christ by Wilhelm Reich. And I like to quote the conclusion of this book. The general conclusion of this book is that civilization will start on the day when the well-being of the newborn babies will prevail upon any other consideration.
Bob is an attorney. He is busy, successful, and leads a fulfilling family life. Medical orgone therapy has helped him deal with generalized anxiety.
Stand not talking and breathe and stay with it, and you'll feel more instead of talking.
I wasn't anxious about any particular thing. I was just anxious, physically anxious.